this problem, we aim to find an appropriate risk assessment to prevent PPS in Skonakon Hospital, Thailand, for safe life of pregnant women, and also reduce maternal deaths in ethnic group in this province as well. Research methodology. This is a retrospective case control study of 1,101 pregnant women were over 28 weeks of gestation age and had vaginal birth delivery at Skonakon Hospital during 2018 to 2019. This study was divided into two steps. The first step, develop and test the risk score tool and predict like Natacon model with pilot study with 100 cases of vaginal birth at Skonakon Hospital first. We use the developing and predict model as figure 1. The risk score tool for prediction of PPS by Natacon has been used. Here is the flight sheet from 8 predictor. Case has score mark 4 mark. Control has score over 5 mark. From multivariable analysis to prediction risk factor for PPS in cases which has blood loss over 250 millimeter to 500 millimeter shown is significant at least 2 to 5 variable as shown in table 1. Step 2. Finding the risk factor related to give an appropriate risk assessment to prevent PPS from 1,001 cases of vaginal birth at this hospital. Figure 1 shows ROC curve at blood loss over 250 millimeter as shown in figure 1A and over 275 millimeter from figure 1B. For prediction of PPS after delivery, revealed that for 250 millimeter is about 62% and for 255 millimeter blood loss has a specificity about 93%. Figure 2 reveal ROC curve at blood loss over 3 millimeter as figure 2A and over 500 millimeter blood loss as shown in figure 2B. Both blood loss have over 90% of specificity. For accuracy are about 60%. For discussion, this study used the model for prediction of gyne by Natacon model because this model can able to predict the risk of PPS by the 8 predictors. The major risk factor related to PPS comparing with other studies in Thailand. The risk score tool for prediction by Natacon could be used in Skonakon Hospital by adjusting the volume of blood loss, the optimal cutoff score, and some predictors. The risk assessment of PPS at Skonnakorn Hospital was able to test from blood loss over 250 millimeter to over 500 millimeter. But the appropriate risk assessment for early prevention of PPS should be treated with the volume of blood loss since over 250 millimeter. At the optimum cutoff score of 5 marks and concentrating much more on 4 predictors. First, fundamental high over 38 centimeter, current in pre-pregnancy, gestation hypertensive disorder, and gestation age over 48 weeks, with significant at p-value less than 0.05, which can reduce PPS. Especially low resource city surrounded by mountains and forest area, and also having various ethnic groups of pregnant women as in Skonnakorn province. We would like to thank the Department of Obstetrics and Gynecology at Skonnakorn Hospital for data supporting, and also thanks to Ajahn Ian Thomas and Mr. David Freeman for grammatical correction. Here is my references. Thank you for your attention.